Let's get right to the Miller Lite Jersey Central Newsmaker hotline. I want to welcome in my special guest. He's a leading orthopedic surgeon at the Hospital for Special Surgery. And this is the time to talk about some trends with some youth sports injuries that are happening. And kind of ironically enough, as we come off a segment regarding addiction and how sometimes it begins at the youth sports level. Let's welcome in one of the most respected people when it comes to treating youth and scholastic sports injuries. And he is Dr. Josh Dines, who is with us here on WCTC. Doctor, good morning. Welcome. It's Burt Barron. How are you?
Bert, thanks so much for having me on. Doing well, thank you.
Well, 'tis the season, I guess, for student athletes, whether it's boys and girls, whether they're playing football, soccer, field hockey. This is the time when you see people get hurt once in a while. And I guess injuries are kind of inherent with sports no matter what level. Right, Doctor?
You're absolutely right, and it's the season, as you mentioned. Unfortunately, that's become a year-round thing. So it's always the season, but we're seeing more and more of these kind of youth sports injuries.
Yeah, is it just the competitive nature of people nowadays that everybody wants to just outperform the other person, and maybe they're kind of working harder to be as best they possibly can be at sports? Because growing up here in Jersey, and every once in a while, you'd see somebody in high school that I went to, walking around with a crutch or something because they got hurt in a game. Are just people nowadays maybe a little more competitive, Doctor? Have you seen that in recent years?
Well, I think people have always. I'm sure you were competitive when you were an athlete, but I think part of the issue is that increased competitiveness, or even the same competitiveness, has parlayed into more sporting activities, where it used to be when I was growing up, you'd play on your school team and you'd take the weekend off. Now, all these kids have coaches and travel teams, so it's just that many more potential exposures to injury than you had in the past. You used to rest on the weekends or play different sports in different seasons. Now they've all become sort of year-round activities, and I think just a lot of it becomes overuse injuries also, which in young kids we never saw before.
Yeah, you're right. That's a great point. Specifically, the ACL tear. When I was growing up and you hear about, someone injured the ACL, it'd be like, okay, well, that's it. They're done. They'll never play again. But it seems like in recent years, with some medical advancement, an ACL tear or an ACL injury is by no means the end of someone's sporting career, right?
No, you're absolutely right. I think that's one of the benefits, and that's probably why, not that we're seeing more of them, but you're seeing people get back after them, which makes you more aware of ACL tears. It used to be, okay, you tore your ACL, you're sort of done, you're not playing sports anymore,
yeah.
So it'd be kind of out of sight, out of mind. Now you see these guys, on crutches because they're already starting to work hard to get back, and probably about 95% of the time, especially in the high school level, people are going to get back to their previous level of sport.
Do you have
it's a long recovery, but they do it.
Do you have young people, Dr. Dines, who are getting the Tommy John surgery? Because the rule of thumb used to be, until you're a certain age and you want to be a baseball pitcher, listen, you don't mess around with these fancy pitches. You just learn to throw a fastball, because throwing curves and sliders takes a toll on your elbow and your shoulder and whatnot. But young people now are needing this type of this surgery that's known as Tommy John surgery?
You're absolutely right. So it used to be you'd only see it at the professional level, and over the last 10 years, if we look at the data, probably the majority of them are being done in, unfortunately, not professionals, but more in the sort of teenagers, the 13 to 19-year-olds. And clearly, I think that gets back to what I mentioned earlier in the talk, which is, it used to be when I grew up it was in New York, you'd play in the spring and then summer, but then you'd play football or soccer in the fall and basketball in the winter. Now, even things like baseball are all year. They've got pitching coaches, they've got indoor academies. So these year-round playing, which used to be limited to Florida and Texas and California, is now everywhere, and kids are throwing more. There's such a sort of stress on the radar gun to throw hard that also is just a setup for the ligament to break down, and we're seeing these ligaments break down at an earlier age. And unfortunately, if they want to keep playing, it requires surgery.
Yeah, we need a modern player, a doctor who's had the Tommy John surgery, because for a generation of student athletes, they have no idea who Tommy John was. For me growing up,
right.
He was a great lefty pitcher for the Dodgers and then for the Yankees, who was just a fantastic thrower. But they don't know who Tommy John is. But when you hear
right.
Tommy John surgery, you kind of know what they're talking about.
Unfortunately, we do. I think that speaks to the biggest problem, the fact that they know it because of surgery, not because he was a good pitcher.
Exactly.
It's the biggest problem.
Right. Shoulder injuries. Do you see a lot of those, doctor? And what sports do you see a lot of shoulder injuries?
Yeah, a ton of shoulder injuries, and it really breaks down into two big camps. One of the traumatic, so you mentioned football season, so it's a lot of shoulder dislocations, shoulder separations, where shoulder dislocations where the shoulder pops out of place, very common in football players, lacrosse, hockey, any of these sort of contact sports. And then at the other end of the spectrum are the more overuse type injuries. So along the same lines of playing too much, we're seeing the rotator cuff tendonitis, labral tears in baseball players, swimmers, volleyball players, a lot of these overhand athletes who just subject their shoulders to thousands of motions a week, and they start to break down.
Yeah, and it's like you had mentioned, it's sports at every level is a 12-month-a-year thing now. It really is, and boy, to see these injuries here is just remarkable. You're also an assistant doctor with a couple of pro teams with the Mets and the Rangers. I cannot imagine what it must be like to keep a hockey team up and running, because you just beat your body up for months and months and months at a time, whether it's blocking shots, getting checked into the boards, dropping the gloves to fight somebody. I mean, to keep a hockey team up and running, you have to have your hands full with that.
You hit the nail on the head. I mean, it's I think the game has changed really, where these guys are blocking a ton of shots, and the shots that are being blocked are coming like missiles. So it's a lot of that would fall into the traumatic group of injuries, where it's a lot of X-rays after the game. It's definitely busy because they are getting a lot of checking and hit by shots, and the potential for broken bones or really bad bruises and contusions. The good news for the hockey players is that they are just amongst the toughest people in the world. So these guys never complain. It's amazing. I'm always amazed if they come in for an X-ray, after the game, and I said, "When did this happen?" And they said it was the first shift of the game, and I'm like, "You played for an hour with that? That's amazing."
Right.
They are so tough.
Only a hockey player, right? Only a hockey player says, "Well, stitch me up. I got to get back out there." Right.
Exactly.
Right.
Exactly.
That is fantastic. Anything you can prescribe to the Rangers to maybe get them to score a couple more goals, Doctor?
Well,
it would be nice to get a win,
Yeah, they're young, but hopefully it'll start to click. They're great guys, so hoping it turns around.
I hope so. Sure. It was great speaking with you today. Can someone contact you and come see you? I know you do work for these pro teams, but do you see the public for injuries and things too?
No, of course, and that's the majority of the practice. Thankfully, the Mets and Rangers couldn't keep me busy enough, which is great. So I'm always happy to see people with injuries. So I appreciate you putting that out there. I'm at Hospital for Special Surgery in New York.
Awesome. Is there a direct line, or how does someone just maybe go through the website to find you?
If you go to the website and look for Josh Dines, we can get you in.
All right,
so
terrific.
I really appreciate that.
Great speaking with you, Dr. Josh Dines, this morning here on WCTC, and keep these teams healthy and keep our student athletes healthy too. It's really an important thing. And
equally as important.
Thank you for all your help and all your work, and it was great talking to you today. Okay.
Thanks for having me on. Have a great day.
You as well. Thank you. All right, Dr. Josh Dines, my